Namaste, good morning, good afternoon, good evening, friends all around the globe. I am Radha Paudel, nurse, author, and activist. We are live through the Facebook page of Global South Coalition for Dignified Menstruation. Global South Coalition for Dignified Menstruation is a global network for advocating dignified menstruation globally. I have two good news to share with you all. Last March 19th, we presented the paper on dignified menstruation at UN CSW 65 forum. We presented from USA, Sri Lanka, and Nepal. And another good news, just yesterday, WHO recognized our documentary for award. That documentary has already available under the title of Breaking the Silence, Bleed with Dignity. Today, we are very excited. We have a friend, global menstrual hygiene champion, all the way from Kenya, Jems Atito. He will, if I do mistake, he will introduce himself. And Jems, on behalf of Global South Coalition for Dignified Menstruation, heartily welcome to you. And I like to request you to start from your introduction and how do you inspire to work on menstruation. Welcome, Jems.
All right. Thank you so much, Paudel, for that introduction. Just to start, as you've mentioned, I'll introduce myself briefly. So my name is Jems Atito. I am from Kenya, a county called Mombasa, the coastal side of Kenya. I work at a community-based organization known as Stretchers Youth Organization, which we co-founded with my colleagues back in 2011. And the main purpose or reason for starting this community-based organization at that time was to capacity build young people who are mostly our schoolmates in high school on matters of drugs and substance abuse, menstrual health issues, and sexual reproductive health as a whole. We had seen incidences of young people engaging in drugs and substance abuse. And so we thought it wise to start an initiative that will bring and capacity build young people, just bring them together and train them to the best of our knowledge. So after a number of years, we transformed as a youth group. And then in 2015, we registered afresh now as a community-based organization and changed our name. Initially, we used to call ourselves Stretchers Youth Group. And in 2015, we now changed from a self-help group to a community-based organization and called ourselves Stretchers Youth Organization. So we operate across a number of counties in Kenya. In Kenya, we have 47 counties. And as an institution, we currently operate in at least 5 counties across the country. But when it got to issues around menstrual hygiene management, in 2016, we were implementing a project with one of our partners called DSW Kenya. And during that time, they were introducing the issues of menstrual cup to a number of girls in Mombasa County. So within the project, there was an aspect of having men engagement. And that is when I started doing my research, because at that time, my younger sister was one of the beneficiaries of the menstrual cups. So I wanted to really understand what are the components, what is this menstrual cup all about? So I started doing a lot of research around menstrual cups, and the issues of periods came along. And so I started doing a lot of research around menstrual hygiene management. And I got a number of materials, studies that have been done around menstrual health, issues to do with products, pain management issues, and so many things encompassing menstrual hygiene management. So I continued with the men engagement since 2016, 2017, up to 2018. Then in 2019, I traveled to some counties within the country, and an experience that I met in this county that I had visited was quite astonishing. It was late in the evening. I was walking by, and then we came across about 7 girls who were seated by the roadside, and it was late and raining. So I asked the person we were walking with, why are these girls seated by the roadside at night? So this person we're walking with told me that those girls were menstruating, and according to the culture, it is a taboo for girls to sit at home during menstruation. So I thought at that point that something was not right, and especially to come with issues about men involvement in menstrual health. So when I went back, or I came back to Mombasa from that trip, I thought of how best can I advance the conversation on menstrual hygiene management. And so I remembered a point when we were doing the training in that county, because I had gone there to train them on life skills, the girls on life skills and issues around menstrual health, as part of a program that was being implemented by the Kenya Red Cross at that time. And when I was demonstrating the use of menstrual cup, there is a girl who asked me a question. Why do you talk about periods and yet you're a man? In this community, men don't talk about periods. Are you a period man? So I reflected on that name and thought, why did that girl think that I'm a period man? Can I use this name to advance the conversation? And so from that day, I decided that I will be the period man. And I accelerated advocacy on menstrual health. When it came to 2020 January, I now thought of how do I now advance this name to something programmatic that I can use to influence change in the community. So I designed a program for it under the brand name. I registered, I copyrighted the brand name as an advocacy brand with the Kenya Corporate Board. So to allow me now use it officially and legally to advance conversation on menstrual hygiene management. So from that period, moving on, I've been using the brand name to specifically advance conversation on menstrual hygiene management. And that is cutting across the country through sensitization, capacity building, and influencing change through advocacy across the country. That has been just a short description of how the Period Man brand came into place. Sorry, you are muted.
Thank you so much. It is really so inspiring, so moving. I hope the audience will motivate to work around menstruation. While working as a man for the menstruation, what kind of challenges you face? I'm sure you must experience challenges with while working with the girls, with the men, with the policymakers. Would you share a little bit about the challenges while working as a men champion?
Well, challenges have been there, especially in communities that are more in the rural setup. most families or most communities have grown up knowing that menstrual health is a women issue. And so most people still don't understand why a man would come out, call himself the period man, and talk about menstrual health, walk around with sanitary pads and distribute to girls. Yet women are there in society to do such things. So it has not been quite easy. There's a lot of opposition at community level, especially for those who don't understand why it is important for men to engage in this conversation and activities. So the taboo that has been long existing has made people quite a bit ignorant on just getting accurate information for them to change their mindset. And that is one challenge that I'm struggling with to change, so that we are able to have a society that is all inclusive, that is understanding every aspect of menstrual health. Because what I've realized throughout my implementation of programs is that people associate menstrual health with sanitary pads distribution alone. They are forgetting that there are other components that are very important to the life of a girl, especially when it comes to issues around pain management, issues around access to quality menstrual products, issues around general advocacy, making people aware that there is this accurate information that are key to sustainable menstrual programs. So that is one challenge. The lack of information is one challenge that I've been dealing with, and just making sure that I advance this conversation at all levels and every person I meet. Another challenge also has been always, when you look at my advocacy, I've been doing a lot of social media campaigns. And so sometimes I have hundreds of messages in my inbox from women, from men, just criticizing why I'm talking about periods in public, since they believe that it's something that should be talked about in secret. So those are just some of the few challenges that I've been experiencing, not forgetting the major one around resource mobilization, just making sure that I get resources to advance this conversation, to develop programs that are really sustainable to influencing change in the community. So those are some of the challenges that I've been going through as a man. But alongside the challenges, I've been having people who support my initiative. I've been working with different partners at community level just to make sure that I bring this movement to life, just engaging as many private sectors, individuals, NGOs, and even government institutions. I've been working closely with the county governments, the national government, just to make sure that I also get that moral support from the community, from people who really understand programs around menstrual health to influence change across the communities. Yes.
Thank you so much. You said your government has been distributing menstrual pad free since 2017, right? In 2019, Kenya was quite popular across the international media. I read the suicide committed by 14 years girls who menstruate in school. I read in Guardian, BBC, CNN, everywhere in the international media. How do you see that for that case? What are the learnings or insights from that case for Kenya, for you and the entire globe who are working on menstrual activism?
Yes, Paudel, I agree with you, and it was one of the unfortunate cases that has been happening in our communities. the incidence of the girl committing suicide because of period shaming. It is true that it happened, and that was very unfortunate. And you realize that that incidence happened even amid the government program to distribute sanitary pads in schools. So you will notice that the problem is not only sanitary pads inaccessibility, but the person who shamed the girl probably did not have accurate knowledge and skills to handle menstrual health issues. Suppose this person had accurate knowledge on the impact of period shaming, he would have not done so. Suppose this person understood the kind of challenges that this girl perhaps was facing as to why she even soiled her dress in class. He would have not perhaps shamed this girl. So across the country, and this does not only happen in Kenya, we have scenarios in different countries. We understand that the most important or the greatest gap that has been existing in terms of menstrual hygiene management programming and even interventions is the lack of accurate and timely information. Most people, even those who are learned, some don't understand the components of menstrual hygiene management. And that is really wanting because we have a number of girls, like right now in Kenya, we are talking about a statistics of 65% of girls unable to access menstrual products. This is such a big number. And the issue of products is just one of the needs that girls have. But there are also statistics that say girls don't engage in menstrual health conversations with caregivers, even at household level. Therefore, you realize that the gap of information is wanting. There is need for partners, stakeholders, and every person in the sector of menstrual hygiene management to ensure that they have a program that has robust engagement, robust menstrual health information dissemination, so that people get to understand what are the components of menstrual health, what are the different types of menstrual products that girls can use at household level, at local communities. You know, most of the times when we go to the field and distribute sanitary pads, we assume that these girls are going to use all these sanitary pads. But there are some people who react to different menstrual products, but they are not aware of what are the other alternatives. So if girls are able to have accurate information, and not only girls, but also their caregivers, men involved at workplaces, in schools, at community, in public forums, if people have accurate information on menstrual hygiene management, then we are going to prevent a lot of negative effects, like the ones we experienced of a girl committing suicide. Issues around period shaming will come to an end. Issues about even enough planning and budgeting at government level it will be something that will be easily manageable, because you realize the government, for example, we've made strides in Kenya. Currently, we have allocation of 480 million annually, Kenyan shillings, set aside for buying sanitary pads. But you realize at the table where these decisions are made, many times we have men in that table. And if they don't have accurate information, therefore, it is going to be difficult for them even to defend the budgets, to even increase that allocation, because they feel maybe that is a lot of money. But you and I know that menstrual health is a very wide component that needs strategical planning, resource allocations, and just to make sure other components like pain management are also factored in different commodities for persons living with disabilities are also captured in, so that we have an all-inclusive programs that touch on each and every person within the society. So there is still need to break the taboos, to give accurate information and interventions for girls and women experiencing menstrual health challenges.
Thank you so much. It's really very deep sense, deep meaning that the menstrual hygiene it has a broader perspective. And here in Global South Coalition for Dignified Menstruation, we define dignified menstruation is beyond the hygiene product and infrastructure. That means there should not be differences between 25 days and 5 days during the menstruation regard to discrimination. So dignified menstruation is the overall overarching agenda, very comprehensive, very holistic approach where we can discuss about the human right, political concern, economical concern, social concern, cultural concern throughout the life cycle, not only during the time of reproductive age, from womb to tomb. That means throughout the life cycle, premenopause, menopause, breast cancer, uterus cancer, throughout, even after the death in some cultures, because menstruation is considered impure, dirty, so people are imposing restriction in different way. It is very interesting to know you keep talking about the shaming, the stigma, the taboo. Would you share a little bit about the micro level practices in Kenya? I mean, I know it is very difficult for you as a man, but I strongly believe that you are the real man, you are the role model, you are the champion, and I don't mind to ask in detail, during the first menstruation, during the menarche, what kind of practices have to follow by the Kenyan girls from 1 to 5 days? Would you share that kind of micro level of practices, understanding, perception around menstruation? Because we have so micro details in Nepal. And last week, we had a conversation in Bangladesh, and they also have the same kind of practices. And last month, we had a discussion with the friend from South Africa, and we also have the more or less same. And now I am very interested to know about the practices from Kenya.
Well, the practices are quite surprising at times. And this varies from communities to communities, and also the level of information that individuals have. In some places, the first day of menstruation comes as a very great shock. Some are surprised. The other time I was having a conversation with girls and just asking them, how was your first day like? And one told me that her first day was a very great shock. It was during the period when Ebola was high, the cases of Ebola were there. So she had traveled. And when she had arrived where she was going with her parent, she realized that she was bleeding. And so she thought she had contracted Ebola. And she was very traumatized. And then we have girls who, during their first time, they have not had discussion with anyone concerning how to even wear sanitary pads. And when they first get these menses, they even don't know how to wear sanitary pads. Some stick the pad on the opposite side. You see, the sanitary pad, there is the side that has a glue that touches the panties. So some have been sticking on the opposite side because they don't have that accurate information on how to wear sanitary pads. we've had girls who are chased out of their homesteads because it is believed menstruation is a taboo. So girls move out of their homes, they stay in the forest for some few days. Like the girls that I met were staying by the roadside until they finished their menses, like for 5-7 days. And some of the practices that have been there is that girls in different platforms use different materials throughout the menstruation, the period. Some use leaves as a product because those are the ones that are readily available. Some use feathers because that is what is readily available. The hen feathers or bird feathers. Some have been using cow dung, the dried cow dung. They take the cow dung, they put it between some cloth, then they dry it up, they use it as a menstrual product. And others have been using menstrual cloth that are not very hygienic. Some use mattresses, pieces of mattresses and pieces of clothes that are not very hygienic. And that is because, one, the information is not there. They don't understand what are the repercussions, what are the health effects of using these unhygienic menstrual products. They don't have means. Some of them is poverty. They don't have, as much as they have the information, but they cannot afford the menstrual products. Some have been engaging now in sex for pies just to make sure that they have this menstrual product that are bought from the shops. So it has been different experiences for different girls in different setups. So that is where now we come in. As we engage with the girls, they share the experiences. We are also able to now give them the accurate information. We are telling them now, for example, today we've come with sanitary pads, but tomorrow we will not be there. What will happen? So we are helping them understand that there could be household materials or household solutions that they can use. Currently in Kenya, we have the menstrual health management policy, 2020-2030. Then the policy has been broken down into strategies for 5 years, then it shall be reviewed again for another 5 years. And these strategies explains in depth of structures or ways that girls can manage their periods. And it talks about hygienic and safe menstrual products. It does not specifically talk about sanitary pads. Therefore, when we are giving information to girls, we're telling them, today you can have the sanitary pad, but how about tomorrow? Tomorrow, you can use, if the readily available product is a menstrual cloth, for example, then make sure that this menstrual cloth is very clean, dried on the sun, so that it does not affect you when you use it the other day. We are telling her, there are some people who have been using towels, for example, they cut towels, but initially they don't keep hygiene of this menstrual product. So what you tell them is that it is not bad to use the towel, yes, but make sure as you use the towel, it is clean, washed very clean, dried in the sun, so that it does not affect you or cause any infection later. So our advocacy has been on clean and hygienic menstrual product, not only sanitary pads. And then we've been emphasizing on use of the reusable menstrual products because we also understand the issues around sustainability. So as much as we teach on hygiene, we also teach on various products that are available in the market and the best way that these girls can use this product so that they are able to sustain menstruation with dignity without fear or any challenges that come across with access of the products. Yes.
Thank you so much. While you were explaining about the product, some girls have been using the cow dung to manage the menstrual blood, right? But I
Yes.
read the research, I read the book on menstruation around Africa and said that it is not true. It is exaggeration of the hygiene part. That kind of thing I read in a book that was published in 2019. How do you see to what extent it is validated? It is only in the remote areas or poor poverty stricken area, or it is happening everywhere?
Well, the issue of girls using cow dung during menstruation, it is not exaggerated. It is something that happens. I personally have friends who have confessed and told me that they've used cow dung as a solution during menstruation. And the reason why they used, she even made me a sample of how they do it in the village, how they make the cow dung, they put it in between a cloth, they dry it, and they actually say that it is a very good absorbent. Okay, so it is something that happens, but it does not happen everywhere. Like I told you, each community has their own products. We have communities that use leaves. We have communities that use the cow dung. We have some that use the feeders. So it depends also with the kind of activities or agricultural activities that go around within a community. Like, for example, the issue of cow dung is a community that they keep a lot of cows. So that is the most readily available product that they can get. We have some communities that they rear a lot of poultry. They do a lot of poultry rearing. Therefore, the mostly available product is feeders. We have communities that do a lot of farming, and the mostly available is the leaves, for example. So these are products that are really being used at community level. Unless you work and interact with the communities, you will never understand how serious the issues are. You see, sometimes you can ask me a question and I respond on how I think, but how I think might not be true based on what is happening on the ground. So when we interact with these people, we realize that these are things that are happening. Girls are using cow dung, and it is not exaggerated at all.
Thank you so much. It's really moving. And personally, I'm very touched, and we have to work a lot to make our menstruation dignified. Our advocacy should amplify, and together we are advocating in this issue. Please count us as a Global South Coalition, and our girls deserved dignity during menstruation. How do you see the influence of religion or culture on menstrual practice? It is only matter of the poverty, or there is a other influence from culture, religion? How do you see?
Well, I think looking at how things have been happening is that whatever religion talks about, the emphasis that is always given at the religious places is that the issues of some religions here, people mention the issues like it is a sin to engage in sex during menstruation, for example, but it does not specifically provide platforms for people to discuss menstrual health in conclusiveness. So the influence of religion has not been very active in providing accurate information. I think the approach has always been on what is it that is sinful that we can prevent, rather than what is it that people need to know about the entire issues of menstrual health. And so that is why, even as we engage in my advocacy, I engage a lot of religious leaders so that they just provide platforms. Even if they don't talk about it, they invite myself and my team to go and talk about it, so that the congregants in those religious facilities are able also to get accurate knowledge. So we continue engaging them, because we know that religious places are platforms that people trust, that people engage, that people really can get to learn more. So we are taking advantage of those places just to make sure that we capacity build as many people as possible from religious institutions.
Thank you. In this given scenario, what kinds of activities have you been doing through your organizations? How do you engage the people for the menstrual conversation?
We've been doing a number of activities. The first thing we always do is we train champions who also we equip them with skills around the comprehensive menstrual hygiene management issues. So these champions work hand in hand with community health volunteers at the county government level, just to make sure that they capacity build these young people. They strengthen the knowledge that these people have. So through the champions, we have community barazas, we call them youth villages. So in these youth villages, we mobilize both men, young boys and young girls. We sit and have this genuine conversation about periods. Like the other time on Friday, we were having a session. Is period sex okay? And this was a community forum that had it was a more of intergenerational dialogue, where we had even religious leaders come into that session. We had people in private sectors, employment bodies. We have adolescent girls in this session. So we have these intergenerational dialogues that we engage different people at different level, so that we just have this conversation free. We open that platform for people to discuss about menstruation, because these are conversations that have not been there. People talk about HIV/AIDS, people talk about teenage pregnancies, but people don't talk about menstrual hygiene. People don't talk about periods. People don't talk about pain management during menstruation. People don't talk about different available products that are in the market. People don't talk about issues around how persons with disabilities manage their menstruation. People who cannot use the normal sanitary pads that are available in the market. So we use these public events. Sometimes we organize public events, outreaches, where we just engage people using theater groups, short skits and dramas to pass the information, using small short videos, passing information around menstrual health. So alongside the trainings, alongside the community dialogues, alongside the public events, we've been doing mini conferences, both virtual and also offline sessions, just to make sure we are reaching as many people as possible, because we also understand that there are some places that you cannot have engagement online. So you have to do physical meetings. So we've been engaging in those kind of activities across the country.
Thank you. We, Global South Coalition for Dignified Menstruation, believe menstrual talk dignity first. Whatever the program you have been doing for the menstruation, but start from the dignity. You may work for menstrual cup or tampon or education or infrastructure, it's okay. But you start from the dignity, menstrual talk, dignity first. How do you see that approach? What would be your comment in this regard?
Well, Paudel, we all agree that dignity first is the best and one of the best approach to look at it. because menstrual hygiene management is not only a health issue, but it affects a number of sustainable development goals. Take, for example, a girl and a man, or a woman and a man having a small business in a community. Every week, for example, let me say this woman is suffering from endometriosis. Every month, maybe 7 days, she has to be in hospital. These 7 days, as she is in hospital, the man is continuing the business. So the woman is losing twice. One is that she cannot be in her business promise. She cannot do business. Two is that she's spending a lot of money for treatment as she is in the hospital. So she cannot engage in the business, and at the same time, she's losing resources. So it makes it difficult for these two people to be at the same level. That is one thing that we always look at, even as we engage the community, to make people aware that menstrual hygiene management does not only affect an individual, but it affects entire society. It affects how a woman or how a girl engages in school. It affects how a woman, the women's performance at school and learning institution. It affects businesses and work. The issues of decent work are affected when menstrual health issues are not factored in well. The issues about water and sanitation, the issues about gender equality. These are all SDGs that are highly affected when you talk about menstrual hygiene management. And unless we focus on finding sustainable solution at grassroots level, at household level, then it will be difficult for us to achieve these sustainable development goals. And the first part of achieving the sustainable development goals is ensuring that every person's dignity is upheld. So the dignity aspect is not something to question or to even debate about. Everything has to start with dignity. How you package the information, how you deliver it, is dignity that will help this girl receive that information with a good attitude. It is dignity that will help this community engage with this girl in a dignified manner. Therefore, my say and approach towards all this is that dignity first is the best approach that one can ever use in achieving sustainable menstrual hygiene management programs, and not only in selected places, but across communities, across governments, across every institution that is looking forward to advance menstrual hygiene management. Therefore, dignity first is the best approach one can ever employ in as far as menstrual health management is concerned.
Yeah, I do agree with you. Globally, since 2014, the organization started to talk about menstruation. And mostly it starts from the hygiene. And it is important. Hygiene created the space for the menstruation. Earlier, only the medical people, only the business people talk about the menstruation very silently. There is no open discussion. Menstruation is in this universe for last 4 billion years. That means times of Homo sapiens. But we never talk about menstruation. That is why globally we are facing varieties of issues. Some were visible, some were not visible. Some were long list, some were short list. But there is something. Just a couple of days before, there is a one research report published and says that there is no difference between high income countries and the low income countries regarding to the menstrual discrimination. That means the menstrual discrimination is happening everywhere because of the silence, because of the ignorance. because of the misinterpretation of our realities, stories, successes, and so on. So this is the high time to discuss about the menstrual dignity to achieve our overarching goal for equality, justice. In this given scenario, what would be your suggestion for us for menstrual dignity or dignified menstruation? Is there any ways we can work together because Kenya, Africa and Asia mostly fall under the global south. That means we are low income countries, poor countries, uneducated countries, and how could we advocate? How could we make our voice louder and bigger? So everyone, no matter whether people from global north or south, no matter whether the organization or people follow the Hinduism or Christianity, no matter whether we are tall or short, our issue is menstrual dignity. This is the very common, very essential things we have been since our existence. So how could we work more concretely? Do you have any suggestions or advice for us? For us means entire community who believe in the menstrual dignity. Please go ahead.
Well, one of the things that I would really encourage as we talk about menstrual dignity is that many times in conferences, in meetings, in dialogues, women or girls have been talking about the need to engage men in this conversation. The issue around men engagement. But one thing that we always miss is telling the men, how do we want the men to engage? The aspects of men engagement need to be put clearly. And even as we continue with this advocacy, we need to tell men how they need to participate in this conversation. And one thing we cannot forget to put or to mention for men is that we realize that many families' heads are men. That means most of the budget holders are men. But we have these men not having accurate information on menstrual hygiene. If a man does not have accurate information, that means she will rubbish when a girl says that she's in pain. She will look at period pain as something very normal. She will not understand that there is need to even have stock of menstrual product at the household. She will not understand that there is a time that this girl needs just maybe some few hours or even a whole day to rest. If the man is the boss at work, he might not even understand that my employees need maybe a day off during menstruation, so that they just get to have the environment that is friendly for even to go through the painful process. So accurate information and education to men is something that we cannot rule out. It is something that needs to be incorporated at all levels, at household, so that men can be able to budget adequately for menstrual health, ranging from the products, ranging from painkillers, just setting aside maybe a medical cover for girls who have really severe painful cramps, so that these girls get first-hand assistance at household level. We need to engage men at workplaces so that we have even a sanitary pads bank, or even a point where girls can feel safe to change for maybe the menstrual product that they're using. We have workplaces that don't have menstrual health friendly toilets, but unless we engage the men at the leadership positions so that they understand how important these aspects are, then it is going to be difficult to really have the dignity first at place. So information and accurate information to men is very important, so that men are able to budget adequately, so that men are able to talk and provide the environment for discussion at household and workplaces. Because if an adolescent girl is not able to freely talk to parent, and especially male parent at household level, then it becomes difficult even to share the challenges that they're experiencing. And that is why we've been seeing cases of fibroids. Girls suffer from fibroids, from endometriosis, from ovarian cysts, from various infections, but they cannot address these issues with the caregivers. Why? Because the caregivers don't have the information. The men don't understand the challenges that the girls go through. So as we talk about men engagement, let us give accurate and timely information to the men as much as we can. Let us continue disseminating information in all platforms. Let us run these campaigns online. Let us be very vibrant so that we are able to show the need. I like to give an example. Right now, almost every country across the world has attention to COVID-19 response. Why? Because every government have realized that there is need to address the pandemic. And almost every day we have ministries of health addressing the nation on the updates. How many COVID-19 cases have emerged? How many people are admitted in ICU? How many people are dead? It has attracted the attention of the government because people talk about COVID-19 every day. So if we talk about menstrual health every day and accelerate the conversation at different platforms, the government will see the need to even budget for these aspects that we're talking about. We've been talking about all-inclusive approach to menstrual health needs that different people face, but little has been mentioned about persons living with disability. I have a good friend of mine. She's suffering from a spina bifida. She mentions to me that she's not able to use the normal sanitary pads that are available. She's very active, but she cannot use the sanitary pads. She cannot use menstrual cup. She cannot use a tampon. What is she left with? She's left to use baby diapers, because that is the only product that can hold both urine, feces, and also the menstrual blood. So you realize that even the companies that manufacture menstrual products have not factored in persons living with disability to provide solution to them adequately. Therefore, our advocacy still needs to be amplified to different institutions, to government institutions, to manufacturers of menstrual products, and even to programmers like you and I, so that we are able to have interventions that touch on each and every person. When we talk about the issues of stigma and dignity first, we cannot forget about the challenges that transgender men are facing when it comes to menstrual health. We cannot ignore that these are our brothers and sisters who also menstruate every month, and they need access to this menstrual product, because the stigma about transgender men has been there for a very long time, and it even makes it difficult for them to access these services. But it is through our advocacy work that will help these people also get access to the services that they deserve. So we all need to approach it with a very sober mind, with no feelings about it. Just sit down with policymakers at different levels, sit down with men, sit down with everyone to make sure that accurate information on entire menstrual hygiene management course is really looked into, is well budgeted for, is well implemented, so that we are able to see sustainability in our programs moving forward. And I think that is when we incorporate all those aspects in the dignity first, we are going to see a very great change at community levels.
James, thank you so much. I totally agree. Everywhere, in informal and formal setting, male are holding the power. At home, at school, in parliament, everywhere. And all men are not violent, not bad. There are many good men like you, like you. There are real men like you. And we need to amplify, we need to increase the numbers of real men, role model men in our menstrual conversation. And just last April, UN General Secretary announced that the home is not safe at all. The women are living in a situation of shadow pandemic. That means there is a violence. And at some point, half of the population globally menstruate. And they experience stigma, shaming, not access with the products or money or participation. There are so many things are related with the menstruation. It is really inspiring talk with you. Actually, the 1 hour time is not enough. We have to organize the second set of discussion. We also published this book last year, last December. We started to celebrate International Dignified Menstruation Day for December 8th since 2019. Many countries all around the world, they already started to mark that day. And in this book, there is a one chapter on why and how should we engage men. And the writer is Lakshman Belbase, who is the co-director of Men Engagement Alliance, Global Alliance. So, and you are very close with this book. And I'm so happy and proud to have you today. We have so many questions, but we cannot respond. Few I saw in a chat, few in messengers, but we don't have enough time. Global South Coalition for Dignified Menstruation have been conducting the webinars in Nepali, in English, and looking for in other languages as well. If any of you, I mean the participant audience, like to host the program, we love to provide the Zoom link, or we are happy to support as a technical assistance. And without talking, without having dialogue on menstruation, we could not make it, because even the child have to cry for the feeding. So we are no more child, and we have so many issues everywhere across the globe around menstruation. And menstrual discrimination is the key underlying cause for the power construction, and that impact in social, cultural, political, economical, environmental aspect of the human being. Not only the women, not only the girls, not only the trans men or queer, not only the person with disability or menstruators with disability. Everyone is suffering. So if any of you like to have a conversation, if you have any interest or title, just let us know, and we will do research, we will find the speakers, and we will come in next session. Today we have about to finish, and thank you very much, James, and friends from Kenya, Nebili, your friend who connected, who make connection with you, and we are in the same world, and together we can make it. James, thank you so much, and I would like to hear the last message to the men. What would be your last message before saying goodbye? Thank you so much.
Well, my message to all men has always been that menstrual health information or periods has been one of the greatest things and the most interesting conversation I've ever engaged in. So let's all talk about periods at household level so that we are able to support our women, our girls, our daughters, sisters, wives, mothers, and any other person that is menstruating at household level, so that we can be able to promote dignity right from the household level. When we do that, we shall stop having issues related to sexual parts. We shall promote the dignity of our women. We shall ensure that our society grows up a healthy one, and just make sure that the empowerment you talk about, the women empowerment, is real. Empowering women does not only benefit women, but it benefits the entire society. So let's not get tired of supporting women whenever we can. Thank you so much.
Thank you so much, James. It's really inspiring. Thank you. Thank you. I'm so happy and sending big hug, virtual hug.